So today we're going to be talking about an antimuscarinic called scopolamine. Scopolamine is also known as transderm scope, and it is an antimuscarinic that blocks the activity of the muscarinic ACH receptors. And it's mainly used to reduce nausea and vomiting due to motion sickness or recovery from anesthesia. But it can also be used for some Parkinsonian tremors, and it also can decrease drooling in some instances. So mainly it's used as a patch behind the ear, but you can also give it orally or intravenously. And these are the different dosages that people get depending on what they're using it for.
Okay, so pharmacokinetics, as Kayla just mentioned, it's delivered subcutaneously through transdermal patches, typically behind the ear. 4 hours, you should apply it 4 hours before you need the desired effects, and the effects will last 3 days. You can take it orally, but it's not usually done because of increased adverse reactions such as dry mouth, increased liver toxicity, vertigo, hallucinations, drowsiness, and there are just a lot less adverse reactions with intranasal spray or transdermal patches. Mechanism of action, motion sickness arises from conflicting afferent info from the vestibular and somatosensory systems. Scolopamine is an antagonist to those receptors. So it just blocks the receptors that would relay info to the vestibular system and cause dizziness.
So there are a few drug interactions that people need to be aware of if they're on this medication. It interacts with alcohol, sedatives, tranquilizers. They all may increase the drowsiness. Other anticholinergics will increase the anticholinergic side effects. Some of these drugs include belladonna, alkaloids, antihistamines, tricyclic antidepressants, and muscle relaxants. There's some other precautions and contraindications. In general, you want to be careful if the patient has pyloric obstruction, urinary bladder, neck obstruction, or intestinal obstruction. If they have impaired metabolic liver or kidney function, it could increase the likelihood of a central nervous system effect. It is also considered a pregnancy category C, which could cause birth defects if you're on this drug, and you should not drive or operate dangerous machinery while using it. Some of the main adverse drug reactions include dry mouth, which is the most common due to the anticholinergic effects. It also can increase drowsiness, dilates the pupils, or can blur the vision, especially if the drug comes in contact with your eyes. And then it also can cause disorientation, memory disturbances, dizziness, restlessness, hallucinations, etc. And there will be withdrawal symptoms if you're on it for more than 3 days, which can include dizziness, nausea, vomiting, headache, or disturbances of equilibrium.
Okay, so monitoring. Patients should use caution when performing tests that require alertness, such as operating heavy machinery or driving. Also avoid alcohol consumption when taking this drug. Use caution with other drugs such as sedatives, tricyclic antidepressants, and other anticholinergic drugs, and muscle relaxants. You want to wash your hands after applying the transdermal patch so that you're not getting it through other areas of the skin where you don't want it. It does contain aluminum, and it will burn the skin during MRI scans, so you don't want to have it on during those. And you do want to monitor the skin around the patch because you can get burns as a side effect. Alright, special considerations. So you don't want to use with patients with angle closure glaucoma or with patients who are hypersensitive or allergic to the drug. Children and elderly are at increased risk of adverse reactions, and there is no safe established amount for children. With a study done with pregnant women, 9 in 114 newborns had jaundice, which was 7.9% of the study population. A A placebo population only showed 1.8%. So there's an increased risk of jaundice. Nursing mothers, a study found that scolopamine was excreted in human milk, so you don't want to take if you are breastfeeding. So complementary drug therapy, a study done with acupuncture showed that acupuncture may improve the cognitive defects caused by scolopamine. In a study done with scolopamine-induced dementia, lavender essential oils significantly increased antioxidant and anti-apoptotic activity, so it acts as a neuroprotective agent. Asteraceae extract made better the cognitive impairments induced by scolopamine, and also Bacopa monera showed to reverse the effects of retrograde and anterograde amnesia caused by scolopamine in rat studies. The herb studies are more alternative, they're not complementary. So.
Okay, and then implications for physical therapy. This drug is mainly used as to decrease dizziness and nausea and vomiting, but if you're post-surgical, it can allow physical therapy to start as soon as possible because it's going to decrease those side effects. So in total, it'll decrease the hospitalization time and medical costs, and you'll be able to get in there and start physical therapy with patients sooner. Like I said earlier, it also assists in treating Parkinsonian tremors. So that can help with patients who have tremors and other types of drugs aren't helping. And then with cerebral palsy, I found some studies done that they use this drug to treat excessive drooling, which can help for physical therapy, and you're able to do more with the patients. This drug also helped decrease their respiratory distress and amount of suctioning that they needed.
All right.
And that's that.
Thanks for listening.